Hi everyone, my name is Whitney and I'm a dental hygienist. I'm the one you see for your routine dental cleanings every 6 months at the dentist. However, last year, most of us dental hygienists didn't get a chance to see our patients for the recommended twice a year visit. And it's all COVID's fault. With the shutdowns, dental offices being closed, and people trying to social distance, a lot of people got behind on their preventative dental care. And unfortunately, skipping dental checkups didn't just cause an increase in tartar and stain buildup on our teeth. The onset of gum infections actually raised some people's risk of serious COVID-19 complications. An analysis of COVID hospitalizations found that people with chronic gum disease were at a statistically higher rate of requiring hospital ventilator treatment than people without gum disease. Now that the curve is flattening out and people are able to get back to their dentist for checkups, most of us are having to revamp our oral hygiene routine to undo the damage living through a pandemic did to our teeth. If you've been staying at home, not brushing as often as you should since you're not going out, or you haven't been flossing as all the days blur together, it's time to get back on the right track. And how do we do this? Number 1, make sure you're brushing twice a day, minimum, and for at least 2 minutes at a time. Even though brushing won't remove tartar and stain buildup, it will help it from getting worse by removing plaque. Plus, all of that added stimulation to your gum tissues while you're removing the dental plaque will help your mouth be overall healthier. If your gums are bleeding when you brush, that should not be happening. Remember that your mouth is the gateway to your entire body, and if your gums aren't healthy, your overall wellness can suffer as well. We don't want those bacteria in your mouth traveling through the bloodstream to other parts of your body, especially if you have heart disease or diabetes. Keep brushing twice a day. Ideally, you want to angle your toothbrush toward your gum line and use extremely light pressure as you brush your teeth and gums. Angle your bristles at 45 degrees toward the gums. Focus on 1 to 2 teeth at a time. Make short, vibrating back and forth movements. Move to the next tooth, making sure you clean the entire outside, inside, and chewing surfaces of each one. It should take you at least 2 minutes to clean your whole mouth. And remember, always use a fluoride toothpaste. But if you really want to expect to see a difference, you also need to be flossing on a daily basis. Cleaning between your teeth will help you avoid severe gum disease, associated tooth loss, bad breath, and a greater risk of coexisting medical conditions. Here's how. Use a strand of floss at least 18 inches long and slip it down between 2 teeth. Glide the floss up and down the side of the tooth as well as below the gums against each tooth. Really hug the tooth when you're doing this. Lift the floss up and over the gums, then move on to the next tooth. If flossing with traditional string floss is too hard or uncomfortable for you, consider investing in a water flosser. With water flossers, a steady stream of water flushes the areas between your teeth and around your dental work. They can sometimes replace traditional string floss, but always ask your dentist or dental hygienist which cleaning between your teeth method that they think is best for your individual mouth. But as a side note, they can get a little messy, so give yourself plenty of time to practice. After about 2 weeks of a solid, dedicated home hygiene routine, your oral health should be fairly manageable. But again, make sure you're scheduling professional cleanings at your dental office to remove the tartar that accumulates between visits, because you can brush and brush and brush until you're blue in the face, and that tartar will not come off at home. If it's been over 6 months since your last appointment, that's too long. Like I said, you can't remove tartar safely on your own, and if you leave it there for too long, it will lead to other issues like gum disease and bone loss. But one more thing that we haven't talked about yet is your tongue. During COVID-19, a lot of people suffered from mask mouth and bad breath because you weren't staying hydrated having that mask on all day. It's actually estimated that about 90% or more of the bacteria responsible for bad breath are from our tongues. Knowing how to clean them off effectively can boost your breath, especially important for when we want to all start venturing out again without our masks. Pro tip, invest in a tongue scraper. It sounds gross, but it's not. It's just scraping off plaque bacteria from your tongue. It's amazing what it can do. Clean your tongue at least once a day, and if you'd like, feel free to add in an alcohol-free mouthwash as well to help your mouth stay moisturized and fresh. And if you don't have a tongue scraper, you can also use your toothbrush. We know that oral infections can raise our risk of heart attack, stroke, pneumonia, stillbirth, erectile dysfunction, and a host of other health issues. So if you made it through the pandemic staying safe from COVID, but you didn't give much attention to your mouth, right now is the time to take action to be as healthy as you can. COVID or not, a lot of us just don't brush and floss the way we're supposed to. Or we rush through it so quickly that we're leaving a ton of plaque bacteria hidden inside of our mouths. It's like washing your car but not cleaning the doors. If you really want your entire mouth to be clean and the overall health boost that comes with it, you have to pay attention to each part of your smile, including between your teeth and tongue. So that's all for today. I look forward to seeing you all again next time. Until then, keep smiling.